Welcome, hospital executives, to our obesity and diabetes healthcare program proposal. Why do we need a new obesity and diabetes program? Rising rates of obesity and diabetes have been steadily increasing in the United States in general, including in Santa Clara County. The county has a diverse population, and certain communities may be particularly vulnerable due to social economic factors, lack of access to healthy foods, and insignificant health care. There are disparities in the frequency of these conditions based on factors like race, ethnicity, and income. Certain populations in the county may have higher rates of obesity and diabetes due to factors such as limited access to health care, cultural dietary habits, and environmental factors like areas with limited access to affordable food. Both obesity and diabetes are associated with other chronic conditions, such as heart disease, stroke, and kidney disease. These conditions are not only a burden on the individual's health, but also lead to higher healthcare costs, which can strain the local healthcare system. Obesity and diabetes can have significant social, emotional, and economic consequences. These include loss of productivity, higher healthcare expenses, and decreased quality of life for residents. A focused program could help alleviate these impacts. A new program focused on prevention could help reverse the trends of obesity and diabetes in this county. This could include educating people about healthy eating, physical activity, and regular screenings, as well as providing support for those at risk. So let's talk about the program. The Obesity and Diabetes Healthcare Program in Santa Clara, California will be designed to address the growing health challenges of obesity and diabetes within the local community. This facility will typically offer a variety of services aimed at the prevention, management, and treatment of obesity and diabetes. It will target individuals who are at risk who are currently dealing with diabetes and obesity. The target population and demographics are adults and children with obesity and with diabetes. The program will serve a wide range of age groups, including adults and children, particularly those with a high risk of developing diabetes or obesity-related health issues. It will also focus on individuals who are already diagnosed with type 2 diabetes, prediabetes, and obesity, but also work proactively with those at risk to prevent the onset of these conditions. Santa Clara County's program will cater to underserved populations, including low-income families, minority groups, and individuals from diverse cultural backgrounds. These populations often face more significant barriers to addressing health care and their higher rates of obesity and diabetes. Hispanic, Asian, and African American populations are particularly targeted due to the higher prevalence rates of diabetes and obesity within these communities. The program will also include culturally tailored educational materials and outreach to ensure effectiveness. Special attention will be given to individuals with limited access to healthcare, either due to lack of insurance, language barriers, or geographic limitations within the county. And let's discuss the facility. The program will be joining our established healthcare system. The facility will be important, so an existing building on campus will be rented monthly with a 5-year lease contract. The space must be renovated to fit the program's needs and be equipped with an LED sustainable lighting with automation to reduce power usage. The program will be physically open Monday through Friday, 8 to 5 p.m. for the official hours of operation. The scheduling telephone lines are open Monday through Friday, 8:30 to 5 p.m. The facility will serve personalized consultations with healthcare providers, including physicians, dietitians, and nutritionists, to help individuals develop a healthy, sustainable approach to weight loss, blood sugar management, and overall wellness. It will include creating tailored meal plans, diabetes management strategies, and weight loss regimens, which will include physical activity, exercise programs, and structured fitness programs led by certified trainers to promote regular physical activity. It will eventually also include group exercise classes, personal training, and sometimes even home-based activity plans designed to meet the needs of individuals with varying mobility and fitness levels. The program will also include behavioral and mental health support. We will be partnering with our already established psychiatry department for these particular support. Psychological support to help individuals manage emotional eating, stress, and other mental health issues that can contribute to obesity and diabetes is important, and so is cognitive behavioral therapy and other therapeutic approaches to promote long-term lifestyle changes. The facility will also offer workshops, support groups, and educational seminars focused on nutrition, healthy lifestyle habits, and managing chronic disease, as well as community outreach programs. We eventually want to include school-based initiatives, workplace wellness programs, and community health fairs that aim to raise awareness about obesity and diabetes prevention. So let's talk about our goals and objectives. Our goal is to reduce the incidence and severity of obesity and type 2 diabetes in the community through education, prevention, and accessible healthcare services. Our first objective will be to increase awareness and knowledge of healthy eating, exercise, and lifestyle choices among 80% of the program participants within the first 6 months of enrollment. Our second objective is to provide free or subsidized access to regular screenings, nutritional counseling, physical activity programs, and aiming for at least 70% of our participants to engage in these services within the first year. To better understand the program and break it down, we did perform an SBAR assessment. Our SBAR is S for situation, B for background, A for assessment, and R for recommendation. Our situation. We currently reside in Santa Clara County, which is in the Bay Area of California. Our board of directors and CEO of our healthcare system has established a goal this year that they want to better address the community's healthcare needs. So I was tasked with establishing a physician outreach program featuring treatment for an epidemic health concern in our county. I examined the county's healthcare data to determine a health problem of prevalent need and design a program to help alleviate these community concerns. Some of the factors and considerations I had to consider were cost, staffing, facility, policies, and its potential impact on staff, administrators, and vulnerable populations. The executives in my healthcare system also wanted to ensure that the physicians, staff, and administrators are held to ethical and leadership standards and align with the practices to promote a supportive work environment governed by transformational leadership. These conditions that I have identified within my data analysis were obesity and diabetes. Obesity and diabetes rates are in the rise in Santa Clara County, which are contributing to significant public health concerns. In particular, there is a growing prevalence of type 2 diabetes and related complications. Both conditions are preventable with proper intervention, early detection, and lifestyle changes. The county's diverse population, including significant low-income and underserved communities, faces challenges in assessing health services, nutritious food, and opportunities for physical activity. So let's discuss the background. Diabetes and obesity are two major health concerns that have significant implications for public health, particularly in regions like Santa Clara County, which has a diverse and growing population. On average, around 2022, diabetes was the 5th leading cause of death in Santa Clara County. Addressing these conditions is critical as both obesity and diabetes contribute to a wide range of serious, often preventable, health complications. Obesity can contribute to an increased incidence of type 2 diabetes. Obesity is the leading factor for many chronic conditions, including type 2 diabetes, heart disease, and stroke. In Santa Clara County, the obesity rate has steadily increasing. During a recent check of our data, approximately 30% of adults in the county are considered obese, which is a significant concern given the association between obesity and numerous health problems. This is especially true among certain demographics in the population. Lifestyle factors such as diet, lack of physical activity, and social economic conditions play a significant role in these health conditions of obesity and diabetes. Santa Clara County, with a population of over 1.9 million people, has experienced an increase in obesity rates, particularly among children and adults in lower income neighborhoods. Obesity is a major risk factor for severe chronic diseases, including type 2 diabetes, heart disease, and hypertension. The occurrence of diabetes, particularly type 2 diabetes, has also increased. The county's racial and ethnic minorities, including Hispanic and African American communities, has a higher risk of developing diabetes due to their genetic, cultural, and social economic factors. Existing programs in the county have been making headway in addressing these issues, but there are gaps in access to care, culturally tailored interventions, and long-term engagement in at-risk populations. Our assessment. What improvements would result from investing the resources to tackle a problem? The current obesity and diabetes interventional efforts are fragmented, and with some public health initiatives exist, there is a need for a comprehensive, community-driven, and culturally relevant program. Strong collaboration between healthcare providers, local government agencies, community-based organizations, and schools is needed. The challenge is the lack of access to healthy food in some areas, limited opportunities for physical activity in under-resourced neighborhoods, language and cultural barriers to accessing care, and a lack of targeted educational programs for at-risk populations. So what is our recommendation? To develop a comprehensive obesity and diabetes prevention and management program that focuses on the following strategies: education and outreach by launching cultural sensitive campaigns in multiple languages to educate the community about healthy eating, physical activity, and the dangers of obesity and diabetes. We want to eventually coordinate with schools, churches, and community centers to reach diverse populations regarding access to healthy food. We want to expand access to healthy food through partnerships with local grocery stores, farmers markets, and community gardens, especially in areas identified as food deserts. We want to increase the opportunities for physical activity in nearby neighborhoods. We want to partner with local gyms and fitness centers to see if we can get them to provide free or discounted memberships for low-income families. Health screenings and early intervention are important, so we want to see about providing free or low-cost screenings for obesity, diabetes, and prediabetes at a community health clinic and other accessible locations. We want to implement early intervention programs for individuals at high risk of developing diabetes, focusing on lifestyle changes, including nutrition and physical activity. Collaboration and network supports are important. We want to establish social groups and peer counseling for individuals managing diabetes and obesity. We want to continuously monitor the program's effectiveness throughout community feedback and healthcare collection. We want to address and improve the program based on what works and what doesn't. This program would be designed to reduce obesity and type 2 diabetes in Santa Clara County while addressing the unique needs of its diverse population, focusing on sustainability and long-term health outcomes. This facility will serve personalized consultations with healthcare providers, including physicians, dietitians, and nutritionists, to help tailor meal plans, diabetes management strategies, and weight loss regimens, including physical activity and exercise programs and training, and sometimes even home-based activities designed to meet the needs of individuals with varying mobility and fitness levels. The program will also include behavioral and mental health support with our neighboring psychiatry department. So there will be psychological support to help individuals manage emotional eating, stress, and other mental health issues that can contribute to obesity and diabetes. So that is very important. And so is cognitive behavioral therapy and other therapeutic approaches to promote long-term lifestyle changes. This facility will also eventually include workshops, support groups, and educational seminars focused on nutrition, healthy lifestyle habits, and managing chronic conditions, as well as a community outreach program, including school-based initiatives, workplace wellness programs, and community health fairs that aim to raise awareness about obesity and diabetes prevention. And of course, we want to implement policies, procedures, and initiatives for when the program starts. We want a combination of policies, procedures, and initiatives because it is essential to creating transformational work environment in the obesity and diabetes healthcare program. These elements should promote collaboration, innovation, patient-centered care, and employee well-being while aligning with the organization's mission with its objectives for improving health outcomes. We want to implement policies that prioritize patient-centric personalized care, plans tailored to the unique needs of individuals with obesity and diabetes. We want to integrate a multidisciplinary approach while healthcare providers work together to create comprehensive treatment plans. We want to establish policies emphasizing preventative care, such as educational programs on healthy lifestyles, nutrition, and exercise. We want to create guidelines for each diagnosis and prevention in diabetes and obesity to help manage and mitigate long-term effects. We want to develop policies that promote the health and well-being of healthcare professionals themselves, such as mental health support, stress management resources, and work-life balance initiatives. We want to foster a working environment that values employee health, including operations for flexible work hours, telemedicine, and on-site wellness programs. We want to encourage policies for collecting and analyzing patient standards data to improve outcomes, track progress, and optimize care plans. We want to ensure compliance with ethical standards in patient data management. focusing on patient confidentiality and data security. We want to institute policies to address healthcare disparities, ensuring access to obesity and diabetes care for underserved and vulnerable populations. We want to standardize procedures for coordinating care across a multidisciplinary team. This will include defined roles for dietitians, endocrinologists, exercise specialists, mental health professionals, and our others. We want to facilitate regular case reviews and collaborate meetings to discuss patient progress, challenges, and treatment adaptations. We want to implement regular training programs for staff to stay up to date on the latest research, treatment protocols, and technological advances in obesity and diabetes care. We want to standardize procedures for engaging patients in their own care, ensuring they are informed, motivated, and actively involved in decisions about their treatment. So our program will be joining an already established healthcare system. Our current organizational structure does start at the top with our board of directors, including our chairman and our members. Then we have an executive leadership team. We have our chief executive officer, chief operating officer, chief financial officer, chief medical officer, chief nursing officer, chief informational officer, our chief human resources officer, and our chief quality officer. Then for our clinical departments, we have our department chair, and we have specialty areas including primary care, endocrinology, nutrition, bariatrics, and weight management. We also have our attending physicians, fellows, and residents. In our nursing department, we have nursing directors, nurse managers, registered nurses, and nurse practitioners. Our patient services and support, we have our patient service managers, our medical assistants, our nutritionists, our front desk staff, and our medical and billers.